manifesting symptoms. Sorry. So this is around from 2 to 21 days.
Oh, it's a long time.
Yes, 2 to 21 days. So that means that you may get the infection today, the virus today, and in 2 days you're already showing symptoms. Whereas someone else may get the infection today and they may wait for 20 days. That's when they start manifesting symptoms. That's why it is very important when you come to the hospital, the doctors will ask you a lot of questions. Where have you been? Did you travel? Whom have you been interacting with? How are the people at home? So all this is trying to establish the mechanism of how you were infected. Yes.
Wow. So you've said you were going to actually tell us the symptoms at a later stage.
Yes.
If the disease has progressed.
Yes. So as the disease progresses, we start seeing the vomiting, you lose appetite, we see the diarrhea. Then as it progresses further, that's when now the hemorrhage starts. You start to vomit blood, you start to pass blood in the stool, and as you get weaker, you may find reddening of the eyes, then bleeding from openings, can be from the nose, can be from the ears, can be from the eyes, and other places.
The disease is scary, and we need our viewers to be cautioned and learn how best to prevent themselves, because personally I believe that prevention is better than cure, and that's why actually the relevance of these health and beauty programs to inform you about the prevalent or the prevailing health conditions so that you can learn the best strategies on preventing yourself from getting them, because once you are sick you're not productive in the very community, not your family, your children. So Dr. Damba, if a person has gotten those signs and symptoms and the community has failed to take him to the hospital, or himself, he doesn't have the funds, for example, to come to your health facility, what could be your guidance?
First of all, I would want to thank the Ministry of Health because they have put strategies in place to try and curb this outbreak. So we have some lines that you can call, Ministry of Health lines. I may not have them offhand right now, so but if you go to the Ministry of Health website, you can see them. If you ask any Ministry of Health facilities or hospitals, you can have these contacts. We have contact people put in place by the ministry, whom you can call and they can come and pick whoever is having those symptoms. So but I would also advise that you shouldn't wait for any illness. You shouldn't wait until you're really down. We need to have a good health seeking behavior. You can visit a hospital and they can be able to guide you on whether you're a suspect or not. Yeah, you can reach out to the health facilities, the doctors. For us at CK, of course, you can come if you're not feeling well, and we shall be able to guide you on the next steps. So whether you need to go to a government facility for further investigation, or it may not be Ebola. It may just be a simple flu and cough. It may just be
easy from isolation.
Yes. Yes.
The process I did with the viewers also to learn the treatment, whether it's available. We hear of isolation, we hear of what, and our viewers to learn these very important terminologies in the treatment of Ebola.
Yes. So as we have seen, this is a viral infection, and like any other viral infections, usually they don't have a specific treatment that kills the virus. It is mainly supportive management until your body itself clears this virus out of the system. Yes, so that's why the isolation is important. So the importance of isolation is that you're protecting yourself first of all from getting other opportunistic infections, because during this isolation you're monitored, you're looked after closely, but also you're protecting the other people, your family members, your close associates, so that they don't get infected. So during that process, you're being monitored, but you're also being given supportive treatment. So supportive treatment is where we manage the things that come with the infection and prevent you from progressing with the illness. So for example, we manage the pain, we manage the fevers. If someone is vomiting, they are at risk of getting dehydrated, so you need to replace those fluids. They are losing very important electrolytes. We need to replace them to also support their body system to clear this virus.
Okay.
Yes.
Wow. Thank you so much, Dr. So. And of course, just like want to inform our viewers that Ebola in Uganda stands at 9 confirmed cases, 1 death, and 265 people are under monitoring here in Murago National Referral Hospital. For your attention, so that when you hear about such disease, you also pay attention. You also listen and inform more 2-3 persons in your circle so that they can prevent themselves against this very disease. Dr. Saul, what are some of the challenges that you have faced as a doctor when such hemorrhagic diseases, catastrophic emergencies such like this one, hit a country as a medical doctor?
Yes, thank you for that question. It's a very important question because very few people want to know the challenges of, of the health workers.
We should know them because
they think health workers can withstand anything. So, but besides that, the challenge, some of the challenges we have faced, and the biggest could be misinformation. Misinformation in terms of what gets out to the masses and how they perceive it. Yeah, so like I said, in any kind of outbreak or emergency response, the first thing we need to do is to calm down and not panic. So, but when we have misinformation going around, then it can create panic among the population, and this is not a good thing for us because then you're going to find people finding, because they are desperate, they'll find their own measures. Like from the index case for this outbreak that we saw, the information has it that he tried to go to a witch doctor to seek for more help because he had gone to different clinics and they were not, he was not getting better. So
that's how the cascade was?
Yes. So from some clinics, you know, like I said, usually you get these symptoms whereby you go to the clinic, they check and maybe they don't find anything, they give you some medicine, then you go to another clinic, they check. The
symptoms keep on worsening.
Yes. So that is one of the biggest challenges. So, but also we have friends, health workers who are working in low resource areas. Yes, that can also be a challenge because how will you protect yourself? The protection, yes, yet this is the main key factor in fighting this illness, having the ability to protect yourself as you take care of others. So that can also be a very big challenge.
Okay.
Yes.
Oh, you faced another challenge. I wanted the cascade of how the patient actually kept on, the symptoms kept on worsening and he was rotating around. I wanted the cascade very well because this is what actually happens in the typical Ugandan healthcare system, where the patient visits almost everyone seeking healthcare attention instead of going to a higher level. The moment you fail in a medical center, go to a hospital. For the hospital fails, run to the biggest hospital. Yes. That's how the escalation matrix should be.
Yes.
But what happens at the ground level is different.
Yeah. So first of all, I don't think that it should actually be the patient to run around. I think we need to have, we have a system, a referral system in our health sector. Yeah, at least where I work, I can speak for that because I know we have a referral system as sick care. That's why when you come, probably to Nansana where I sit, and we find that because we're not going to come and we shall do all the tests in the world at once, you know, it's also not sustainable. Exactly. But also it's not, we have protocols as we manage these illnesses. So the first visit, you may get tests done, and what is usually suspected first is not found. So there is a referral system. Probably will be referred to a specialist or referred to a bigger facility where they can do bigger or more advanced tests for any illness. Now I'm speaking generally right now. So in this case, for us, we could refer you to IHK, and maybe they can do more tests. Yes, to find out what could really be the problem. So, but in the case of Ebola, the Ministry of Health, which is governing all of us, has put protocols in place whereby at this first moment we shall be able to have a suspicion that this could be Ebola. Then at that point, we shall be able to bring in the Ministry of Health.
Immediately?
Yes, immediately to take over. The protocol. No, they will have, that is the protocol. Yes, and in this case, the other challenge that we face.
Bureaucracy.
Oh,
like
yes.
Moving from here to here to here. This time it's direct.
Yes, and the other challenge we face in that case is that people, when you tell someone that maybe we need now to send you to this place, which the Ministry of Health has gazetted, they panic because they feel like you're throwing them out, and they fear the isolation. So that is the challenge we get, to convince someone that this isolation is for your own good. And
they give you food. They need the reassurance. Food is a very important factor, and food is an independent variable actually.
Yeah,
you can't live without food.
That is true.
So they need to be reassured. Is there free food? Will they be taken care of?
Yes, I will not speak for the Ministry of Health, so but I believe that by the time they put someone to isolation, they have all these measures in place, because nutrition is important to manage this condition, because you need it to build your immunity. Yes, so maybe just to call upon the population and our viewers that in case, God forbid, that you're in that state, please don't panic and don't worry about the isolation. So far, the people who are in isolation from the first case, they are almost getting out.
Okay. For how long should they be in isolation?
So usually the isolation period is the incubation period. Okay. So you'll be there for 21 days, because we believe by then, if the virus is there, the symptoms would have manifested. Yes. So usually after that period, if you're still okay, and most of them are doing well because they were got in time.
Excellent. Thank you so much, Dr. Dambasol from CCare Clinic, Nansana. As we go for a short quick break, I want to invite you to visit our social media platforms. You post your comment, opinion, suggestion about this very important topic. And when we come, we shall allow a few phone calls, like 3 or 4. So be on alert so that you can ask us any question about Ebola. See you shortly.
Good Day TV, transforming your life. Omulabi waffe omulungi ow'omukutu guno ogwa Good Day TV, tukwebaza, weebale okuwagira era weebale kwekumira ku Good Day TV. N'olwekyo tukutegeeza nti pulogulaamu yo ebadde beerawo buli lunaku ssaawa 11 emanyiddwa nga The Boundless. Sabbiiti eno egenda kutaataaganyizibwamu nga tugenda kutuusaako Revival Service Live wiiki eno okutuusa olwokutaano saa 10 ez'olweggulo okuva ku Makerere Full Gospel Church. Ate olwo pulogulaamu yo The Boundless eddemu okunyumira wiiki ejja okuva ku Mande okutuusa olwokuna ssaawa 11 ez'olweggulo. Mwebale kwekuumira ku Good Day TV, tubaagala nnyo.
As you think of a healthy, convenient drink that boosts immunity, lowers blood pressure, or improves blood fat level, Proden Hibiscus drink is the answer. Thrill with joy always at a very affordable price. Place your order now and we will get it delivered. Call or WhatsApp on 0772 494 618. Proden Hibiscus drink, a product of Proden Distribution Company Limited, Nakawa Industrial Area.
God's Way High School Maganjo. With immense gratitude to God, we celebrate the outstanding achievements of our O and A level students. At O level, we are blessed to have 2 students scoring straight 8s, 2 scoring 9 in 8 subjects, and that impressive 103 first grades. At A level, 3 students achieved an outstanding 20 points, 2 scored 19 points, and a remarkable 8 scored 18 points. We are incredibly proud that all 100 students met the university admission requirements. These results are a testament to the hard work of our students, teachers, and the unwavering grace of God. Here's to continued success.
Freedom Divine oba giyite Freedom Junior School. Essomero lino lisangibwa Namuŋŋoona awo kulinana National Housing Estates enkadde era nga litambulira ku musingi gwa ddiini. Tusomesa amasomo gonna ageetagisa omwana wo okuyita obulungi kuba abasomesa be tulina bakugu mu kusomesa ate n'okufa ku baana mu mitendera gyonna ate nga ne school fees zaffe omuzadde tezigenda kukalubiriza yadde. Mu kiseera kino tuwandiika abayizi abapya okuva wano wamu n'amawanga agatwetoolodde. Okumanya ebisingawo jangu ku ssomero oba yogerako naffe ku ssimu kati kuba 0782 ne 07543836. Freedom Divine School Namuŋŋoona. Pray and work hard. Oyagala byofumba bijje mangu nga tofunye buzibu bwa mukka kosa bulamu bwo. Weekwate mobile stoves tukukolera ebyoto ebikekkereza enku wamu n'amanda omuli ebyoto bya sola ebikozesa volcanic stones wamu n'olusennyente nga tukolera ne biogas okuva mu busa saako oven gattako sawuna erigwa owawaka naawe wa bizinensi ku bbeeyi etakubya ntunnunsi. Kati naba amasomero, amalwaliro, awaka, amakanisa, factories, hotels wamu ne restauranti mutuyite tubazimbire ebyoto bino kuba 0789470896 ne 0750824341 oba jangu ku ofiisi zaffe Namugongo Kyali Wajara Road opposite ne Dawson Petrol Station esangibwa kulidde ekireka.
Good Day TV, transforming your life.
Once again, you are on Health and Beauty program with me, Kamara Daniel. And of course, we bring to you health fascinating topics that are important for your health and well-being. But most importantly, we encourage you to learn the best preventative strategies that are very key to control yourself from getting these diseases. And especially for the persons in Kampala. Remember, I'm still joined by Dr. Dambasor from Sika Clinic Nansana. He's the head of that very facility. If you reach there, you would actually see him personally and greet him. Yes, you should. And of course, we're going to talk about the individual preventative strategies. Then we go to household, and also especially if we talk about the individuals, we're focusing on the persons in Kampala here. These people who use taxis in Ichikubo. You know, in Ichikubo you can touch over 50 people if you're walking, because even, yes, you should walk. You can touch over 50 people, not intentionally, but because people are very many. At household level, you can prevent your family. In schools, we need to also talk about schools, because there are also environments that bring very many people. The churches, You're going to give us the preventative strategies so that we can educate our very population that perspective.
Okay, thank you very much, Mr. Kamala, and our viewers for tuning in. So, like we have seen, Ebola, the way it is transmitted, through contact, through contact with body fluids of infected people, but also from these animals that we have talked about. So first of all, if there is anyone there that is interested in hunting these animals, monkeys, eating bats, I think it will be not a good time to go into that. Maybe we need to find other sources of food, because you can't know if this monkey you're hunting or eating is infected or not. Yes, so but as our community at home, let's prioritize hand washing, because especially with soap and water. So soap is a disinfectant and is very effective in killing most of these germs and viruses. So let's have hand washing at any time you remember. Please wash your hands. Anytime you remember, please wash your hands. So, but notably before you eat, or before you, because it is very hard to know that now I'm going to touch my eyes and wash my hands. That's why I'm saying every time you remember, please wash your hands, because at every moment your hands are getting dirty. Yeah, so that is at home, but also in other places, workplaces, let's have hand washing facilities.
Okay.
Yes, especially at the entrances. If we can't have water and soap, we can have hand sanitizers, alcohol rubs, which we need to apply generously, not just smearing, but apply generously with all your hands, and be able to kill these viruses or germs that may be on your hands.
Okay.
Then 3, let's try to avoid crowded areas. So like you've said, there's a lot of crowding, and you can't know that this person who is rubbing against me
is healthy.
Yes. And like we have seen, the virus can be transmitted through sweat. Yeah. So once you get in contact, you can be able to contract this virus. Then I know in Uganda we are a very social community or group of people. We like greeting, hugging, we like shaking hands. So, but for the moment, we may have to avoid that kind of greeting that involves contact. Not even kubongaing or fist bumping, no. Yeah, so
is it called, okay, I have learned something, fist bumping.
Yes, it's called fist bumping. It's fist bumping. So we can try to
I think Gideon must have been knowing this time.
Probably. Yeah, so but let's try to avoid anything that involves a lot of this contact. Yeah, and there's something that people usually don't want to hear about. So, but if you have multiple sexual partners, because that is another way of transmission. Yes, so you can't know who is infected or not, especially in the early stages.
Okay.
Yes, so these are some of the preventive mechanisms. So, but like I said earlier, let's not panic. Let's not panic, because the Ministry of Health has really tried to handle this with the urgency that it deserves and it needs. And so I believe that all the measures are in place to curb this outbreak.
Wow. Thank you so much, Dr. Damba. Now, I wanted to emphasize on the health workers, especially in the rural health facilities, on quick identification, so that they do not own patients or delay to make a judgment, thus increasing the incubation period when the patient is in the community. Number 2, about the schools.
Oh, yes.
That are gathering our children every day in large numbers. And also the taxi drivers. Yes, actually we can even start from here. By the time we call upon the government to come and enforce some rules, we find that actually taxi drivers have sanitize every person entering.
Yes. Yes. So like you've mentioned, we have these communities that are high risk. So schools, especially day schools, where we have students go out, then come back to school. So they go out and interact with the general population. Then they come back to school and interact with each other and the teachers. So in such communities or places, the SOPs need to be very strict and adhered to. So hand washing facilities should be all over the place in schools and encourage the students to wash their hands, encourage them to avoid contact, to avoid touching their eyes, touching their mouths all the time. Yes. Then also in the hospitals, the health workers, of course, this one they should know that they need protective equipment, personal protective equipment, as they handle any client or any patient that comes in, because you will not know until they are confirmed. Yes, so before you attempt to examine someone who is having a fever, who is having a sore throat, please make sure you're protecting yourself, with gloves, face mask, face shields, if possible, especially for people who are coughing, because the saliva that they cough in your face may come with the virus. So that is very important. So, but also, it is very easy to now exaggerate and everyone you see with a fever and you thinking Ebola. There is no need to cause an alarm. Let us just stick to the protocols and the checklists, and also the triaging of the patients that we have, so that we make the right decision.
Okay.
Yes.
Perfect. Do you have any last comment? We do not call upon the government. What would be your call to government of Uganda, the Minister of Health, in just 1 second? Also, you give us your last remark about this very hemorrhagic disease.
Yes, thank you very much. So I would personally call upon the government to, first of all, continue with the small thing. It is not small, so but to continue with the initial response. You see, the World Health Organization has a mechanism of managing these outbreaks. So it is called the 717 strategy.
717 strategy.
Yes. So which means an outbreak should be identified within 7 days, then reported within 1 day, and then within 7 days we should have found a protocol, or we should have found guidelines on how, or a strategy to curb the outbreak. Yes. So where I'm commending the Ministry of Health, because instead of the 7 days of identifying the outbreak, it took them 24 hours to identify this outbreak, and it was reported within the next 24 hours, and now strategies have been put in place. So that's why I commend them. So, but my call to the government also is to try and put more efforts in the management, especially in supporting the health workers. Yes, with the protective equipment, supporting with the surveillance, supporting with the reporting, and also the response. Because like in earlier pandemics and outbreaks we have had, you could have maybe a patient, you try to reach out to the ministry for the people responsible, and it may take longer for them to respond. So my call to the government is to tighten these measures. Yes, but otherwise we would want to thank them for the response so far. And finally, to everyone, please, let's watch out for each other. Let's take care of each other by following the SOPs. Yes, and those who would want to come and see me in Nansana, I'll be there in Nansana.
Okay.
Yes.
Do you have any special regards to your people?
For my people who are watching, I know my family may be watching. I know my people at the clinic in Nansana at CK may be watching. Just to hold tight. and not panic. This will also come to pass, and God is in control. And thank you for watching.
Thank you so much, Dr. Dambasol. And of course, I want once again, proud viewers, and thank you for watching Google Data Vision, especially the Health and Beauty program. Remember, this program is always on the very social media platforms. Feel free to go on our social media platforms, the Facebook, the Twitter, the YouTube, the LinkedIn, and watch this program all the time, all the day, so that you can learn more. In case you missed any part of this very program, it's there streamed live, and you're able to even put your comment or your opinion or your expert advice that you can again go back and review and even read to our people here live on Google Data Vision. For this very program, I want to thank you so much for having us, and I want to wish you a lovely time while watching Google Data Vision. See you next Wednesday.
Ekiddako ku Google TV. Ekiddako ku Google TV. Ekiddako. Google TV, transforming your life.
Omulabi waffe omulungi ow'omukutu guno ogwa Google TV, tukwebaza, weebale okuwagira era weebale kwekumira ku Google TV. N'olwekyo tukutegeeza nti pulogulaamu yo ebadde ebeerawo buli lunaku ssaawa 11 emanyiddwa nga The Boundless. Sabbiiti eno egenda kutaataaganyizibwamu nga tugenda kutuusaako Revival Service Live wiiki eno okutuusa olwokutaano saa 10 ez'olweggulo okuva ku Makerere Full Gospel Church. Ate olwo pulogulaamu yo The Boundless eddemu okunyumira wiiki ejja okuva ku Mande okutuusa olwokuna ssaawa 11 ez'olweggulo. Mwebale kwekuumira ku Google TV. Tubaagala nnyo.
Tosubwa ku Google TV.
Abagalwa abalungi, erinnya lya Mukama waffe Yesu Kristo lyebazibwe nnyo. Mbalamusizaako, amannya gange nze Kasozi Robert Cephas. Mbanjulira programu ennungi mwogenda okuyita okusisinkana Kristo, okwateko bisuubizo, osumululwe, owangule, eyitibwa You Can Be Delivered. Ngekutusibwako obuweereza obwa Raising David's Tabernacle Ministries wano ku Google TV. Buli lwa Sande okutandika essaawa 5 ez'ekiro, n'olwokusatu okutandika essaawa 3 ez'akawungeezi tugendanga kubeera wamu. Oludde mu bulwadde, olinayo ebintu byonna ebikutawaanya wadde nga walokoka, olinayo ebintu ebyo nga obisabidde naye nga bigaanyi, oba nsonga ya birooto, ng'ebirooto bikufuukidde ebirooto tobitegeera, ogezezzaako eno n'eno. Pulogulaamu eno egenda kubeeramu essuubi, ekyokuddamu, okuwangula, okubotola mu maka, mirimu n'ebirala bingi. Kale nkusaba onneegatteko wano ku Google TV. Akaseera ako kagenda kuba kakusumululwa. Nkulinze, Mukama akutwere omukisa. Tosubwa pulogulaamu eno.
Hallelujah. Live by the word, moment by moment. 2 Kings chapter 5 verse 20, verse 22, verse 26. Okay, bassekabaka ekyokubiri essula eyokutaano onyiirwa abiri lugamba lutya. But Gehazi, the servant of Elisha, the man of God, said, Behold, my master has spared Naaman, this Syrian, in not receiving at his hands that which he brought. But as the Lord liveth, I will run after him and take somewhat of him. Verse 22. And he said, All is well, my master has sent me, saying, Behold, even now there be come to me from Mount Ephraim 2 young men of the sons of the prophets. Give them, I pray thee, a talent of silver and 2 changes of garments. Kumba alimba. Verse 26. And he said unto him, that's Elisha to Gehazi, Went not mine heart with thee when the man turned again from his chariot to meet thee? Is it a time to receive money, to receive garments, and oliveyards, and vineyards, and sheep, and oxen, and men servants, and maid servants? Nti bino byebiro ebyokuvaabika ebintu oba okuvuubika kyonna kyekiri okuvaabira. Wisdom for followers. Amagezi eri gwe ng'olina gw'ogoberera. Ffenna tulina gwe tugoberera. Okusookera ddala tugoberera Katonda. Naye ekyokubiri, tulina abantu be tugoberera ku nsi nga tukola wansi w'obukulembeze bwabwe mu maka, ku mirimu, mu kanisa. We are all followers in one way or the other. Threefold wisdom today. 1, make not man thy source. That is wisdom number 1. Number 2, make not forged stories. Number 3, mix not seasons. Bw'oba olina gw'ogoberera kusabira ebintu bino bisatu obinyweze. Gehazi yali mugoberezi w'Erisa, naye yalaba nti Namani yalina okumugaggawaza nti oba kitwala kulimba oba kitwala kukola ki, nze nteeka okufuna obugagga. Gehazi nawe oyinza okuba oli eyo ng'olaba nti abantu yensibuko yo lwe lusuku lwo, buli olaba abantu oteekwa kulyamu. Make not man thy source. Number 2, make not forged stories for the sake of self-benefit. Even if it's not your own benefit, never make forged stories. Abamu buli kaseera obeera kukutiza wano n'okutiza wali n'ogatagata ebigambo wano na wali ebitakwatagana. Make not forged stories if you're a follower. Number 3, mix not seasons. Bino ebiro Gehazi bye baalimu tebyali byakululunkanira bintu. Mwana wa Mukama, bino ebiro bye tulimu nga tukyali ku nsi tetuteekwa kululunkana. Mix not seasons. Nawe awooli manya ebiro byo. Don't mix seasons kutandika kukola bintu. Gehazi bamubuuza, is this time to get things? Know your seasons. Live by the word, moment by moment, as you purpose not to mix seasons. We love you.
Good Day TV, transforming your life.
Mikwana bagalwa tubanirizaako nate. Programu yaffe ennungi eno etuuse you can be delivered. Katonda wa Isirayiri tumwebaza olw'ekisa kye ekingi. Katonda ono atwagadde, Katonda atusumulula era amaanyi gaffe. Mukwano gwammwe Kasozi Robert Cephas nze ntuuse wano ku mpewo eza Google TV okubanjulira programu eno era n'okugibatuusaako mu linnya lya Yesu Kristo omwana wa Katonda omulamu. Amen. Katonda waffe yeebazibwe nnyo. Njagala kubalamusaako mwenna ate n'okusanyuka awamu nammwe abatuuse ku mbeera ezisanyusa. Ng'olina akatundu k'oyiseemu kabadde kasanyusa kakunyumidde, katugambe ofunyeyo obujulizi wakati mu kintu ky'obadde osabira nga Katonda akuwadde omukisa muno eno okikwatako. Ofunye omulimu omupya oba olinayo omuntu gw'otabaganye naye. Omanyi kigambo kutabagana ate nakyo kikulu nnyo mu lugendo luno.